Hi, this is Dr. Nick. I'm the incrementalist here with Business and Health Insights.
And I'm Fred Goldstein with Accountable Health, here helping companies keep their employees healthy and reopening during COVID. So Nick, once again, we've been doing this for a number of weeks. Very interesting again the last week, a lot of stuff going on. In particular, some new information coming out about aerosolized virus, and what does that all mean?
Yeah, so this is obviously a big concern. People are hearing this. I think there's, major consternation. It seems like the virus can spread further. So what do we mean by aerosolized? What is it relative to droplets? Well, so the difference between aerosolization and droplets is really a size differentiation. So if we have droplets, they tend to be larger. And the thing about larger droplets is that they fall to the ground quicker, which is one of the reasons we have this 6 feet of physical distancing to help protect you. But with the smaller particles, so the aerosolization, so we tend to talk about less than about 5 or so microns. Those particles don't fall to the ground. Gravity doesn't have as much of an impact. And in fact, airflow can keep them up. Just think of the sort of, the leaf that keeps floating on, caught by the wind or drafts and so forth. And that's really the concern here, is that it appears as if SARS-CoV-2, which is the causative agent for COVID-19, unlike SARS-CoV, which was the original SARS and some of the other ones, has a component that includes that, which means that we get the spread. But here's what I would say. Masks still incredibly important and part of the sort of central tenet, and still prevent the spread and minimize your risk. But it starts to change our thinking about what's safe and how to make things safer in terms of removing those particles. Clearly, rule number 1 in all of this is fresh air and air circulation, not air circulation of the same stuff. So if you keep recirculating and it's not being filtered out, that's not a good thing. But air circulation with fresh air included, so if you think about ventilation systems, bring in as much fresh air as possible is a better thing from a safety standpoint.
Fascinating. And I know you also wanted to comment a little bit on some of the international issues going on and what you're seeing there.
Well, I'm always about the adjacent possible. And the question I typically have is, how did they do it? And if you look at Taiwan, they didn't have this national lockdown, yet are very successful in suppressing the disease. They had previous experience, the culture and the society had adapted. And what did they do to essentially limit to a very small number of cases? Well, it was driven by testing. So testing is a sort of core component. We've got to get that right. We've got to get it accurate. We've got to get it upscaled. But then importantly, tracing and following through. But as you follow through and see what they did, what is the culture? The culture is I wear a mask to protect other people. And if I feel sick, I will go out. That's just built in. And it's the same principle that we need to follow. This is not an invasion or an imposition on civil liberties, because if that were the case, wouldn't that be true because I'm not allowed to do 120 miles per hour on the highway? That's an invasion of my civil liberties, isn't it? Well, it's not. Those are the rules, and we follow the rules because it's a safety issue, because if I'm driving like that, unless I'm on a Formula One course, that's insanity. Same with masks, wear masks. So, let's learn from other places. Now, my perspective, Fred, I'm looking at you. We've had discussions in this household as to what's going on in Florida, dude.
Well, as you well recognize, Florida is trying to ring the bell. We cleared 15,300 cases in one day, which is just astronomically unbelievable. And it's frustrating to watch this happen and recognize that this whole issue, like you said, it's about culture. It's about all of us pulling together to solve this problem. And it's about wearing masks and social distancing. And I happened to go to a Wawa the other day, and sure enough, I walk in there because I had to try to find some motor oil for my wife's car late at night. And there were nobody in there with masks other than the staff and one person. I watched groups of 8 walk in, I watched others walking around. And I happened to post it up on Twitter and made the comment that, hey, masks are now required in Jacksonville per the mayor. And I got a response back that that's not true, that the mayor has said all you need to do is recommends wearing them, that they recommend it. No, the mayor put out an executive order that says indoors, can't space, wear masks. Unfortunately, this morning I went to a place where for my truck to get it worked on, and they had a clear sign, you're wearing a mask when you come in the door, and everybody inside did, and I didn't stay inside long because this whole issue of aerosolized. So it's fascinating to watch. Hopefully we control it, but we're now seeing the hospital start to fill up.
So, I'm obviously terrible, pretty bad news. And, clearly face coverings, critical component. But what else can we do? I know you've been looking into some of the detail of, other methods to help us indoors.
Right. There's still this issue of cleaning things and how do you clean things? And we've gone into some of it with the list N from the EPA. And essentially now a little bit deeper, there are places that some of our clients have contacted us and said, hey, we want to clean more areas or clean more efficiently or quickly or clean sports equipment, et cetera, chairs, things like that. Can we use things like a spray, an electrostatic gun, a mister, or a fogger? And clearly, there are some use cases for that, and there are some ways to do it. But the important thing to recognize when you do that is, does the cleaning agent that you're going to select allow for that? Is it on the list N and say for use with a sprayer, mister, or an electrostatic sprayer? Or does the label clearly indicate can be used with one of those tools? If not, it hasn't been cleared to do that, and I would highly recommend against it. So when you look at your EPA labeling for your products, if you want to begin to spray these or others, make sure that that's listed on the label as one of the use cases. And furthermore, as you do this, also read how you need to protect yourself when using that equipment. In some cases, they are recommending N95 masks because you're spraying this stuff at a very small particle size, I guess, or mist. And so they're recommending that kind of protection when actually using the product.
So just a word on N95 mask, because that actually brings up a really important point. In that particular instance, that's the N95 mask that people use on building sites as an example to prevent the inhalation of asbestos dust. But guess what? Those masks typically have a vent on the side to make them easier to breathe that allow for a full expiration of everything that's coming out of your lungs. Do not use those masks to protect people. They are the complete opposite. And in fact, it's like saying, I can't say it on here, to people if you wear them. And I know people don't understand. I think this is a comprehension issue. So please, these masks that are used in specific circumstances for inbound, but they're not protecting the people around you. And that's really bad news.
That's a great point. Thanks so much for bringing that up to close this out, Nick. Once again, a fantastic week talking with you. I'm Fred Goldstein with Accountable Health.
And I'm Dr. Nick. I'm the incrementalist here with insights for better business and a better health.